Thank you, Sheriff Dance, for your words. Thank you for your leadership and recognition about the urgency of our adequately responding to people's health care needs, including their mental health care needs. Senator Smith, Representative Brown, District Attorney Dixon, thank you all for being here very much. Thank you for the service you provide to people of Pitt County. Natasha Holly here, Integrated Family Services. Thank you for hosting us. Thank you for the tour. But most importantly, thank you for offering this service to the people of Pitt County. There are so many people, so many families who experience somebody having a crisis and they need to be stabilized. This is a place where they can come and get that stabilization that they desperately need so that they can then be assessed and connected to whatever service they need in order to have long-term success. I'm so excited about the work that you do with mobile crisis care, co-responder services, school-based therapy, and of course this behavioral health urgent care center. The clinic is doing a lot to help people in Eastern North Carolina. They're taking care of people's health. At the same time, they are making Eastern North Carolinians safer. Here in North Carolina, we've recently suffered two prominent tragic reminders of just how important it is that we do everything in our power to get treatment to people who need it with serious mental illness. Our hearts ache for the families of Irina Zarutska and Charlotte and the three victims who died in Southport. Of course, we're all immensely relieved that everyone else who was shot has since been released from the hospital. The senseless murders raise real concerns for people all over the state. We all know that the vast majority of people with mental health challenges pose no risk to anyone other than potentially themselves. But we also know that some can. There are too many people in our communities with dangerous obsessions, exhibiting threatening behaviors who do pose risks to others. Everyone deserves to be and to feel safe in their daily lives, whether it's on their way to work, at church, in their neighborhood, at their kids' school, in their home. And people dealing with serious mental health challenges similarly deserve to have access to health care so that they have the best chance to live healthy, productive lives. We can and must do more to get people well and to keep people safe. Last week I signed a bill meant to bring us closer to that goal. The bill, however, does not go far enough. Both of the people who committed these terrible acts of violence were suffering from serious mental health crises. If our mental health care system fails to serve people when they need it, then we are failing to properly care for the well-being and safety not only of them, but of all the people of this state. According to the National Association of Mental Illness, 1.8 million North Carolina adults live with a mental illness. Now understand the overwhelming majority, vast majority of those people don't pose risks to others, but they are still not well. And in recent years, on a bipartisan basis, we've made some real progress when it comes to treating mental illness. In fact, this facility is an outgrowth of a bipartisan partnership to address mental health needs of North Carolinians. But we know it's not enough. House Bill 307 didn't put any new money towards mental health or behavioral health treatment, money that would help us to turn the tide. In the coming weeks, I'll lay out a comprehensive mental health plan, but we know there are things that we should and can do right now. And to start, the General Assembly must fully fund Medicaid when they come back to Raleigh in a week and a half. Medicaid is the largest payer in the country for mental health and substance use disorder services. It helps people with mental health conditions see a therapist and afford psychiatric prescriptions. In short, it is a lifeline. The General Assembly must fund Medicaid now. The two chambers, the House and the Senate, refuse to come to an agreement to this point. They agree that more money is needed. They agree how much money is needed. Their disagreements that have kept them from coming to the deal have nothing to do with Medicaid. It's time for them to put the people's health and all of our safety ahead of their political disputes. Send me a bill and I will sign it in October. Second, we need to improve our response when mental health and public safety cross each other. It includes getting people who need it treatment when they first interact with law enforcement. This is called diversion. Get people whose real issue is mental health and not criminal justice out of the criminal justice system and into the healthcare system where they can get treated and become well. There are some positive provisions in ARENA's law to accomplish just this. It also includes what happens while people are incarcerated. This is a moment, it's actually a moment of opportunity to treat people's underlying conditions, whether it's mental health or substance use disorder, and then we want to help them re-enter successfully when they leave jail or prison. There are so many opportunities throughout the criminal justice system when we could just step back and say, hey, this person needs a service. People working at all stages of the criminal justice process need more training and more tools so that they can help make sure that those mental health evaluations take place. Natasha said, we all see people in our community who need help. We just need to take that moment to intervene to try to connect them to the services that they need. And of course, we have to have adequate treatment options for people once we've identified those issues. This crisis center is going to be one of those critical options. Think about someone having a crisis. When someone's having a psychiatric emergency, it can be incredibly overwhelming for their loved ones. We need to make sure that our crisis system is prepared to get them connected to treatment. Integrated Family Services mobile crisis team is a great example of what that can look like. The team is available 24/7 to travel to people who are experiencing crises and connect them to the help and support that they need. Once the experts have assessed the situation, they can provide telehealth or in-person support. The mobile crisis team model works and needs to be expanded statewide to get families the help that they desperately need and to reduce risks to the general public. We need more acute beds to deal with severely ill people who must be hospitalized. Here's a tragedy. The state has over 900 critical care beds, but we're only using about 550 of them. Why is that? Because we do not have enough staff to support the beds and the services that are required. 300 beds where we could be providing people care who desperately need it are sitting empty because we cannot hire and keep the staff. Let's make these jobs much better paid and more attractive so that we can ramp up the state's capacity to meet the needs of our people. Next, we need to make sure that people receive treatment that they need while they're incarcerated. The majority of people in custody in our state have mental health or substance use issues. Sheriff, what would you estimate in your jail? What percentage of people have either a mental health or substance use challenge?
I would estimate around 80 to 85%.
So this isn't a jail. It's a mental health hospital that's incredibly expensive for the public to support. How about we treat the underlying condition that has led to the criminal behavior so that they don't commit the crimes anymore, so that we're all safer and we're saving money at the same time. While folks are in prison, that is the time to connect them to the services and treatment that they need to be set up for success when they get out of prison, because here's the thing, 95% of people in prison get out. 95% of people who are in our prisons will be out at some point. What do you want? Do you want them to be successful, productive, contributing members of society when they get out, or do you want them to go back to a life of crime? We want them to succeed for themselves, of course, but honestly, selfishly, we want them to succeed for us. If people find door after door closed to them when they get out, they will be much more likely to end up doing whatever it was that got them in trouble in the first place. So let's instead open doors of opportunity. There are so many ways that we can support people after incarceration. Supporting them as they find a job, housing, health care, transportation. Without these basic supports, successful reentry becomes so much more difficult. And the risk of repeat crime that affects all of us increases, making us less safe. So let's invest in reentry and treat it like a public safety investment, just like Arena's law that we passed 2 weeks ago. It is time for us to get real about public safety and take meaningful action that will make a difference. Let's roll up our sleeves, actually tackle the tough issues that we know matter, and put in place effective solutions to make North Carolina families safer. Let's get to work. And I want to offer one final word, that tomorrow is World Mental Health Day. This is a great opportunity for us to let all of your viewers know that if you or a loved one is struggling, there are services that exist to help you. Call 988, ask for help. It's there on the other end of the phone. Thank you. Happy for any of the three of us to take questions at this time.
I have a question. So you say that you really want to invest in re-entry. That's kind of the whole point of this. Who's investing in the plan? What is this funding looking like? Where are we getting it from?
Yeah, well, we will need to have state support for a lot of it. I will be working with the legislature. We're going to come up with a comprehensive public safety plan. Some of the items don't require dollars. Some of the items will require dollars, and we will have it all laid out for the General Assembly's consideration.
In regards to rural areas in eastern North Carolina, but also all across North Carolina, healthcare facilities can sometimes be sparse, and sometimes the most affected by mental health struggles are those in rural areas. What in the bipartisan plan and works relates to rural mental health?
We've actually seen an expansion of some services over the last couple of years in rural mental health care, attributable to a couple things. One is this bipartisan agreement that I described that helped to fund this facility. That was an outgrowth of the fact that we expanded Medicaid in North Carolina. On a bipartisan basis, Republicans and Democrats came together arm in arm to expand Medicaid. Today, 680,000 of our neighbors have health insurance who did not before. Disproportionately, those folks live in rural North Carolina. Because folks have a means to pay for care, that now that they have health insurance, more providers are coming to rural North Carolina. That is why it is a travesty that the General Assembly has not fully funded Medicaid, because they have not. Rates for providers have been cut. Many of these providers are operating on the thinnest of margins. So the legislature is now making it harder. It's counterproductive. If we want to have more health care in rural North Carolina, they have to fully fund Medicaid when they come back in October.
And you've mentioned there's been several instances of mental health leading to violence. Even in Dare County, I think a woman was shot by a police because she came at him with a knife. And that was just the day before you signed the bill. So what do you think it will take to get the mental health system really back on track in North Carolina?
Well, there are so many different things that we need to do. One of which, to deal with that situation in Dare County, I don't know the specifics, and maybe nothing could have been done to prevent what occurred. But there are co-responder models, and this organization, Integrated Family Services, does this in conjunction with Greenville Police. When a call comes to 911, and it's clear that it's somebody experiencing mental health crisis, the police will go to ensure that the situation is safe, but Integrated Family Services will go with a counselor who can respond and help de-escalate that situation, because we don't want a tragedy of somebody being killed because they pose a threat to someone else. If we can lower the temperature and de-escalate, maybe we could then connect that person to mental health care facility services that will make a difference in their lives.
Directing your attention to Section B1 of Irena's law, it requires law enforcement to transport violent suspects directly to an emergency department or a crisis facility. How attainable is that, especially for places like ECU Health, where their emergency department is serving 3 or 4 counties? What's the drain on law enforcement, and what's the impact on our rural hospitals?
These are very legitimate concerns, and we have to closely monitor what the impacts are to ensure that we're not essentially stopping the ability of our emergency departments to serve the general public. Because if all the beds get filled up with people in mental health crises, then people who have a broken arm or a heart attack may not be able to be served. So it is a legitimate concern. One of the reasons why we want this behavioral care urgent center, the Behavioral Health Urgent Care Center, to open is because this would be, under the law, a suitable place for Greenville PD or Pitt County Sheriff to take a person for that evaluation. So we want to have more facilities that are specially trained for that kind of population to try to take some of the load off of emergency departments. But it is really critical that we connect people who are experiencing these crises with the mental health care system. And that's one provision in the law that does that.
Now, you also speak about keeping guns out of mentally ill people's hands, and you say by doing background checks and stuff like that, but what if this is somebody that nothing shows up on their background check? There's a lot of times where they're taking a gun from somebody else. How do we prevent stuff like that?
So there are plenty of people who have not committed any crimes and are legally entitled to own a gun, but then later develop some form of paranoia or schizophrenia where it is really not a good idea for them to own a gun. That can't be captured by the background check on the front end because they own their gun. But there's another provision called a red flag law where a family member or law enforcement could go to a court and petition the court in a hearing, due process hearing, and say this person poses a real risk to themselves, poses a real risk to others, and we should take those guns away from them temporarily. There are plenty of states that have those laws, and gun deaths have gone down afterward.
Thank you.
All right? Thank you so much for being here.
One more question, just what we have here, sir. Any thoughts on Cecil Brockman, the representative in Guilford County?
I just read press reports, and the charges are extremely serious and deeply troubling. And while the criminal justice process takes effect, he cannot be effective representing his constituents, and he should resign.
All right. Thank you, everybody. Thank you for joining us today.